Thank you so much for joining me on the Slice of Healthcare podcast. How are you today?
Great. And yourself?
I'm doing well. I'm a little jealous. The audience can't, they weren't able to see this, but you got to show off your coffee, and I don't have mine next to me, and I'm a little lost without it right now. So I'm going to try to do this without coffee. We'll see how it goes.
All right, let's go.
Well, I'm excited to chat with you. I think we should dive right into it. If you could tell the audience a little bit about your background, we will then start talking about Corstrata after that.
Absolutely. So I've always been in healthcare. I started off initially on the academic side of the equation, but I soon realized that, and I want to stress I'm not a clinician, but I soon realized that I wanted to be on the side of the equation of healthcare management and really on the strategic side where, new models of care were being developed. So I went to work for a regional home health and hospice and private duty company where I joined the management team. And we were very early adopters in the early 2000s of remote patient monitoring. And it was there that my co-founder of Corstrata, Joe Eberwine, and I learned that technologies could bring to bear access that could increase efficiencies and reduce cost in the healthcare system. So using remote patient monitoring, we were able to increase the productivity of our nurses, reduce the overall cost of care, and increase our referral sources. So fast forward, Joe and I left that organization and really wanted to take that knowledge base of how do you take that technology and apply it to a problem. And we wanted to apply it in a problem that had not been tackled in a similar way, and that was wounds. And wounds had plagued us as home health and hospice providers. Wounds are high resource utilizers of both human capital and as well as supplies. And so we knew that there were new technologies on the market that would bring to bear access to the experts that could tackle these issues. I also had dealt with an aging parent who suffered at the end of life an incredible struggle with painful bed sores or pressure ulcers. And that left this indelible kind of picture in my mind of there's a better way. He was in a rehabilitation facility after being discharged from a hospital, and he was being cared for by well-intended clinical staff, but that staff had a very limited knowledge about wounds. And as a consequence, he was subjected to this intense pain. And as I came to learn later in my career, that there were wound knowledge that could have been applied to that problem and solved it, if only those clinicians at the bedside could have had access to those experts. And so Corstrata was born. It was basically to provide tech-enabled access to scarce board-certified wound specialists.
The best companies that I have the opportunity to speak with are the ones that have that kind of personal why that you just stated, right? This is something that, although you yourself did not personally deal with it, right? It affected a loved one. And sometimes that even has more of a profound effect on someone starting a company because you're able to really think outside the box or think of it in a different light. It's not happening to you, but you're getting to see it firsthand that it's happening to someone else. So that was a very interesting story you just shared. Thank you for sharing it, by the way.
You're welcome. And, I felt so, there was nothing I could do about it at that particular time. I didn't have the knowledge. I was, medically based. So I knew there had to be an answer to that. And watching him suffer through that pain and not being able to do something about it was very disturbing.
Absolutely. Yeah. And now I think back to some relatives that I used to visit in like these rehabilitation centers, right? Or these rehab centers. whenever they would get discharged from the hospital, they weren't that like they were very appreciative of the staff. The staff did an excellent job of taking care of them. But now that I do think about it, he did have he wasn't exactly comfortable all the time, right? He had he would, because especially at a certain age, you can get a wound very, very easily, right?
Absolutely.
You barely bang into the bedside and you're all bruised up or you're cut up, and it's not, and your skin doesn't heal exactly as quick as it used to, right? So, yeah, this is really interesting, the space that you've gotten into.
Yeah, I mean, it is, and interestingly enough, wounds aren't a medical specialty. So there is not really in their classical medical education a medical specialty for physicians, or even when you go out there to the market to find that medical specialty. There's less than 1,000 board certified wound physicians in the country.
Wow.
And wound care has gotten down to that genetic level. I mean, it requires a knowledge base on how to best tackle this with evidence-based medicine and the most appropriate advanced wound dressings to heal that wound optimally.
Wow. And so it was after this experience that you decided there's got to be a better way to address this, and hence Corstrata was born. Is that fair to say?
That is absolutely fair to say. And the experience of working where technology could provide access. So it was a combo of those things.
Where did the name come from, out of curiosity?
Hey, lots of people ask that. So in one of my previous work lives, I had tried to trademark a name, and of course and we had already put it in marketing production, and it had already been taken. So the first thing I did was we wanted to go and ensure we had a name that was safe. And when we talked with a legal expert, they said, invent it. So my co-founder and I went on about 4 days of looking at every, prefix, suffix related to wounds, and you name it, Greek, Roman, whatever. And it came to bear that cor is the Latin word for heart, and strata refers to the different layers of the skin, as well as the fact that we're based in the cloud or stratosphere. So we combine those two. We have a heart for the layers of the skin.
I love it. Yeah, it's interesting that was your process, because so when I put together like the name of the company for Block Health, right? BLOC is a group of people that join together to solve a common purpose. So that was like, we kind of did that whole like parts of the word mean this, but I wanted to originally name the company. I looked at all the Greek, like God, like I was looking for the Greek god of medicine, and who was the Greek god of medicine's cousin or daughter, or and eventually, like I had to, in the early stages, I ended up actually I don't do cold calls now. I'm actually very against cold calls, but I did. And we were going to go with like Epion or something. And people would always misspell it. And I couldn't even say it without like my tongue getting, just in a weird position. I decided to just go away from that, and we decided to name the company Block Health. But I love your story. I love the logo too. And I feel the pain of going through like the trademark process and things. It's not exactly the easiest setup. To make sure that you get the name that you want.
No, absolutely.
What would you say some of the things you're most excited about as it relates to Corstrata as we head into, I guess we're getting close to the second half of 2021 already, which is scary, but what are some of the things you're excited about that you can speak about today?
So a couple of fronts. When we came to the market, we realized that we could use store and forward wound imaging, which allows a clinician at the bedside to take a photo and then document about that wound and send it to our nurses, who then review that, help really identify that etiology or type of wound. We find 30% of the time that those wounds are misidentified. And if you don't identify that wound appropriately, then you're not driving the evidence-based care. In addition, we recommend the best evidence-based practice and the appropriate dressing. I'm very excited because we are getting ready to raise a Series A through venture capital, and that will be applied to really giving those efficiencies and taking these kind of disparate parts of our delivery system and putting them in one solid platform, which will make it so much easier for the client, whether it's, or the customer, whether it's the nurse at the bedside or the patient themselves, to connect with us. We're also using live video to incorporate into that platform, and we can then be at the bedside with that patient as well. So really this funding will give us the opportunity to do that. The other thing that we've put in place is a new organizational structure, which allows us to go out and practice in all 50 states, and do that in a level of care that that is greater than how we can operate currently because of the new structure. So we've put significant time and capital into developing that structure out, and we hope that to be built out fully by the end of the year.
That'd be exciting.
Yeah.
And by the way, I hope when you do announce your Series A funding that we can have you come back on for a quick 2-minute clip, because part of what we also want to do is we want to highlight those wins and those whatever you want to call it, accomplishments, because that is a step in your journey and towards your ultimate goal.
Absolutely.
So it'd be great to kind of hear your thoughts and see that excitement in your eyes when that time comes. We're going to start doing that more. Yeah,
I think that's great. You know, and I think the other thing that I could add is COVID had an immediate positive effect on our business. You know, it really served as the tipping point for telehealth, and we're that telehealth provider for wound and ostomy expertise. But the other thing that we've noticed is kind of the tailwind of COVID has been the push towards health at home. I mean, that is, and that's where patients want to be served. And that is the lowest cost setting for serving those patients. I mean, we've seen new consortiums of leading edge companies like Amazon, Cares, Dispatch Health, Landmark, and others, including health systems like Ascension, Aurora, and Intermountain. They've all come together under this new moving health home to advocate in the political streams. So I think it's, you know, it's signaling that care is going to come home, and there's going to be a push towards that. So we find that exciting.
Well, I'm excited about everything that you just listed and for Corstrata's continued success. And I look forward to continuing to build our relationship and hopefully have you and other members of the team back on to cover different areas of what you're continuing to do and build. So thank you for all that you do. And I look forward to continuing to build our relationship and staying in touch.
Good.